we have a good real estate agent who really represents clients well. Man, there's a reason that during COVID I hated the term. We were a part of the essential list.
Mm-hmm.
Because the housing industry, not just a realtor, the housing industry is essential for this country.
Yeah.
Every time a house sells, Home Depot gets some money.
Yep.
Sherwin-Williams gets some money.
Sure.
People do blinds, a carpet company. And so there's a reason, and I see the job that realtors do. Can somebody sell a for sale by owner on their own? Yeah, if you're really, really good. But should I go into court and represent myself?
No.
No. I should have an attorney.
Yeah.
Right? And so I'm laying this out because I'm going to go somewhere on it. Because I'm making an argument that it's bullshit that we can't participate in a group health plan similar to, like, why are we any less than a sanitation worker?
Yeah.
Why are we any less than a teacher?
Mm-hmm.
Why are we any less than a city employee who's cutting payroll for the employees in the accounting department?
Yep.
Right? Why are we any less than somebody fixing the roads?
Yep.
So just because they work for a public entity, or just because somebody works a job and makes $18.50 or $19.50 an hour for a local bank, or BP across the street pumping gas, or UDF.
Yep.
So if we're considered essential, but by nature how we have to work, I literally can't make them employees, this is bullshit.
Yeah.
And so, and I ran down some stats, and see, I don't need you to agree with me that's bullshit or not. That's just my statement.
I do agree with you.
All right, so I ran some stats. So there's 4.5 million residents in the state of Kentucky.
Okay.
Is that
sounds right?
Okay. There are 1.2 million people on the Medicaid system in the state.
Mm-hmm.
That I'm not making arguments about need-based or anything.
Yep.
I just know there's 1.2 million people that, because they're on Medicaid, there's a strong argument, and I grew up poor, so I'm going to use that too.
Yeah.
But there's a strong argument that they aren't participating at the same level of production of taxes, production of revenue for a bunch of realtors in the state.
Yep.
And we're not allowed to participate. Like, even let us pay.
Yeah.
Just let me pay a fair amount to be a part of programs.
Yep.
The same way that if you're an employee who's running the cash register at BP gets to.
Yep.
That if you're working at Burger King or you're working a manager of a restaurant.
Yeah.
This is ridiculous.
Yeah, and there's been a huge growth in 1099 with, the Ubers and Lyfts and whatnot. So people are not necessarily falling into these broad categories of what an employee is, and there's getting more of a population who falls into that other category now. And what do we do about that?
Yeah, what do we do? So I do want you to go into it, but here's what I would say. I am willing, as an employer, if I would be an employer and not just a sponsorship of realtors, I would be willing to pay the normal share that a local bank pays for their employees for the program. I'm willing to pay that, and then our realtors are willing also to pay the amount that their employees pay.
Yep.
Like, we're literally like, let us participate.
Yep.
So you're covering 1.2 million people for either free or a reduced amount and letting them participate. You won't even let us pay.
Well, that's government-sponsored program, just to be clear, right?
Okay.
But in your case, you're not allowed to sponsor an employer-sponsored plan where you get the tax benefit, where they get the employees get the tax benefit and you get the tax benefit for participating. And I agree. It's a problem. We started back in FDR times with this employer-sponsored plan situation that we have. Most countries don't do it that way. And, a lot of people have proposed, why do we have employers in the middle of this? It disadvantages small businesses, even though, let's say you're a general contractor and you got 20 employees, right? If you go to the market and try to buy health insurance, you're at a huge disadvantage relative to, I'll pick on a local big business, Procter & Gamble, who they can self-insure because they have so many people and enough money, or they could go to an Anthem and have much more bargaining power, right? So the health insurance system incentivizes large people to go work for large businesses. And I think that's a problem because, especially in Kentucky, small business is the lifeblood of Kentucky. Our economy is it's organized around small businesses, and it's a big problem, and it's getting worse. Health insurance inflation is about 3% higher than your traditional CPI inflation year over year, and it's been like that for 20 plus years. And there's no sign that that's going to be different next year. In fact, the signs look worse.
So let me ask a question here. See, as I hear how things aren't going well in like England or Britain.
Yeah.
There's some issues with the government plan, right?
Yeah.
Canada, you hear about some restrictions.
Yep.
Right? So I'm not an advocate for that. But why? What would politicians make an argument to me about why every self-employed person can't pay their share and be a part of a big pool just like a huge company? Why will they not allow us to do this?
I think it's just – I don't think that a lot of politicians would disagree with you, honestly. I think that it's entrenched in what we do, and healthcare reform is really hard to change. Healthcare is and I'm sorry, I didn't prepare my stats.
That's all right.
It's approximately 18% of total GDP. Somebody can look it up.
Hey, Jack, can you look that up? Just see what the total share of medical costs.
Or what's the share of healthcare industry as a percentage of GDP?
For the whole country, right?
And it's around 18%, which is bananas. Mm-hmm. And so a lot of people make money on that healthcare system, and they have a vested interest in keeping it the way it is today. So that's why it's hard to change, even small rules. So if you want to go to Congress and lobby that, you're going to have to fight the health insurers, the hospitals, the American Medical Association, the insurance agents, because they have a vested interest in keeping it the way it is today.
Hold on, though. I'm saying more people participating in a similar system.
Yeah.
What's their argument? I'm saying let us pay, because I have a bunch of healthy realtors. Mm-hmm. I don't think I have any adverse number of unhealthy people that affect a group.
Yep. I think that's right. The problem is not that.
Is it the employers? Are there big employers fighting against this?
I don't know. I really don't know. I think what I know is that it's hard to make small changes.
You can yell. So what's the percentage of GDP that is for overall medical insurance cost? How do you want to say it, Charlie?
Yeah. I would say the healthcare industry, what does it present as a part of GDP?
For the U.S. economy. You can yell it out to us when you get it.
19.6.
So 20% of – yep, so we're rounding up.
Yeah. So I think it's hard legislatively to make small changes like what you're talking about.
Because this is just saying, guys, these things are already built and done.
Yeah, makes sense.
Like, why can't there be a group –
Yep.
just like a huge company, why can't there be a group that if you're self-employed, you can pay and be a part of and have the same expenses, and they can negotiate just like GM, who's building cars, or UPS in Louisville.
Yeah.
Who would argue against that? We're saying, I'm not messing with the same system.
Yeah.
Let me say, hey, if you medical providers are happy with how it's going, let me give you more of the same.
Yep. No, I think it would be a good change. And the Realtors Association has a strong lobby.
We only have
DC.
10. We got 10. Nationally, but we only have 10. Isn't this state by state though, or would we be battling federal?
Yeah, I mean, the state pass a law that
where 15? Let's just say realtors.
So it's governed by federal law today. So under ERISA is what is getting in your way. I think somebody's going to check me on this. And so you'd have to make changes to what constitutes an employee under ERISA and what constitutes an employer, so that insurers could pull your group together as an employer-sponsored plan.
Like, let everyone who's a tile installer on their own.
Yep.
Like, if you guys, what a lot of people don't know is, if you go to Home Depot or Lowe's or Menards and you buy carpet, or you buy cabinets, or you use any of their installation services, a lot of times those are subcontractors. Those subcontractors don't get to have insurance. And here's what I'm going to say, get to have too. Man, these prices out on, on the ACA, the American 401k, whatever,
Yep.
they're bullshit.
Yep.
I go and look at what those prices cost us to buy an individual policy.
Yep.
And it's the same. If we go through the National Association of Realtors, there's 1.5 million people who are eligible to be part of that plan. It's the same number that gets pulled on the website for the federal government's plan.
Yep.
And it is a ridiculous BS number versus an employer plan on what it's costing them, the combination of them and their employee.
Yep. And, a lot of employees don't know how much their employer contributes.
It's substantial.
To their plan. It's usually, it has to be at least 50% of the single plan.
It's like 80-20, isn't it, a lot of times?
I'd say that's typical.
Yeah.
And, so employees don't know, and so that when they go to start their own business and they're forced to go to the ACA and they see what the full cost of a plan is, they're surprised.
Do you think I'm wrong, though?
No, I don't.
I think the ACA is substantially higher than these full group plans that an employer pays between, from my example, maybe not, but it looks like to me like if an employer is 80-20 and it's $1,000 to cover that employee for the month and the employer is paying $800 and passing $200, that's not a similar expense. I'm going to go out to ACA and it's going to look at $1,600 or $1,800 or $2,000 a month.
I don't have the stats in front of me. I'm going to guess that it's similar to a small business total cost, but not similar to a large business total cost because they have bargaining power.
There you go.
Right?
So why can't every subcontractor that works in the state of Kentucky be a part of one group plan that gets to negotiate prices just like UPS in Louisville, just like Procter & Gamble in Cincinnati, just like Kroger, just like any other big company? I think that's the bullshit.
Well, again, we have association plans, but you pointed out that they're often not run well or their prices are not that advantageous. And the real problem here is that Procter & Gamble can't afford it. And I don't want to pick on Procter & Gamble.
Let's say any large business. We could say Tesla. We could say Ford. We could say GM. Any big business.
Yeah. Apple, for example.
Yeah.
$100 billion in reserve cash. Right. It's not a huge blip on their radar, but for a small business, it obviously is.
You see it every day in your clients.
Absolutely. And I also see even on employer sponsors. So you're concerned that you can't pull your folks together for employer sponsored plans. I see employers choosing not to offer it, and they're under 50 employees, so they don't have to under Affordable Care Act rules, all the time because it's too expensive. And then I also see employers offering, skinny plans with a $5,000 deductible, which is normal now. It used to not be normal. Offering plans with a $5,000 deductible to employees that make $15 to $20 an hour, and they can't afford the premiums on that, and they can't. And a $5,000 health expense would wreck them. That is an enormous problem that I don't hear hospitals, chambers, other people who are interested in the health insurance industry, insurance agents. I don't hear people talking about how big of a problem it is if you make $15 an hour, you can't afford it. And it would wreck your family's finances if you had to incur $5,000, or usually plans are between $10,000 and $15,000 max out-of-pocket cost. $15,000 for somebody who makes $15 an hour, too much.
All right. So there aren't people, and correct me if I'm wrong, you'll know this. If someone breaks a leg, you're not being treated, right?
Well, hospitals are required, if you show up at their emergency room, and maybe this is only true for nonprofit hospitals, but a lot of hospitals are required to treat you if you show up at their emergency room. So if you break a leg, show up, they're required to help you, or you get something worse and you're in an emergency situation. And in emergency rooms, any hospital administrator will tell you they're a loser on cost. But hospitals are making money. They're losing money in the emergency department, but they're making money in other areas.
So people are getting treated. Is this then mostly the preventative piece? The preventative, having a doctor, getting normal, like if you have a colonoscopy, is that the piece that's not being served from medical needs?
Oh, man.
I don't know this. I'm asking.
So there was and again, I wish I was more prepared.
Or any questions you have, Jack, and we'll look some stuff up for it.
So there was a survey a few years ago where they asked doctors what percentage of medical treatment is unnecessary, and they interviewed, or the survey asked, X number of doctors. It was only doctors, and the result came back at 20% of unnecessary procedures. So we're talking about imaging, other types of procedures that you might get, and so that is a big part of the problem. And their hospitals, and any doctor will tell you this, they're incentivized to prescribe procedures or do certain things in a certain way because that's where the profit center is. And that is one piece of the problem. There's others. Price transparency is also part of the problem. And we had an executive order on that in the Trump era. The problem is the penalties, from my perspective, are too low, and hospitals aren't complying on purpose. That's my perspective on it. And so, first of all, it's hard to comply with that rule. But let's say we had a system where hospitals had to say a broken leg being cast is X dollars and a coronary bypass is X dollars, and a huge list. Then big businesses who self-insure, at the very least, would be able to say, an MRI here is $15,000 and here it's $2,000. So we're gonna steer our employees to the $2,000, and that
prices would come down because of competition.
That gives us some competition, but it's not a true health insurance. Healthcare is not a true market like we think of when we think about the market for clothes or bananas, right? And the reason is because the demand curve in healthcare is very inelastic. In other words, if the price goes up, which it has been, we still need it. If the price of bananas goes up, you might say, if it's
I'm going to have an apple.
Yeah, I'm going to choose an apple. But that's part of the reason why healthcare is more like a public good, more like a road or a park or military defense, because it doesn't lend itself to what you would think of in economics as your typical market dynamics, and that's the reason a lot of people push for a single payer.